Let's take a look at the actual numbers. We're going to start with the top line. Obviously, coronavirus cases in the United States, new confirmed cases, and over the course of the last several weeks, a clear trend line up, including several days last week, topping 50,000 cases. So what does that mean going forward? Well, take a look at the map. Now, 34 states in the country seeing new cases up 10% or more. 12 of those states, look at the dark red, up more than 50%. Obviously a harrowing number when you look at the top line numbers. But one of the big questions is death rate right now still lagging behind, not ticking up. But look at what those states are doing. This should give you a sense of the concern that's out there. Reopenings across the country, states are pausing, or in some cases, 5 states, when you look at the dark red, are actually rolling back some of their reopenings. The concern right now is real, and in particular, the concern keys on 3 states, Florida, Texas, and Arizona. You see the case counts as they continue to rise throughout those 3 states. Significant concerns from public health officials in those key states, some governors in those states taking actions. The big question now, though, is what it all means, and what needs to be done going forward.
When you have an outbreak in one part of the country, even though in other parts of the country they're doing well, they are vulnerable. We can't just focus on those areas that are having the surge. It puts the entire country at risk. We are now having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around.
Ominous words from Dr. Anthony Fauci, and joining us right now, Dr. Ashish Jha, director of the Harvard Global Health Institute, and Dr. Megan Ranney, an emergency room physician for Brown University. And Dr. Jha, I know you were on a vacation. I think it was the first few days off you've had since this all began in months. But I want to kind of get your top line view based on some of the numbers that I just pointed out. How do you assess the trajectory of the virus in the United States at this moment in time?
So good morning, and thank you for having me on. Unfortunately, I took a few days off, but the pandemic didn't. And what I see this morning as we look across the country is not just the number of cases going up substantially, they're going up in large parts of the country, so it isn't just localized to a few places. It's clearly not about testing. I know the president has been arguing that this is all about testing. And then what we're seeing, to me, the most concerning part of this, Phil, is that we're starting to see substantial increases in hospitalizations. Texas has about 4 times as many people hospitalized with this virus as it did a month ago. So these are very large increases across many states. And unfortunately, we know that what follows is an increase in deaths. So I'm pretty concerned about where we are, and we really do have to get our act together and try to turn this around.
Dr. Ranney, I want to hit on the point that Dr. Jha just made, because you've heard the president say repeatedly, this is about testing. This is because we're testing more than anywhere else in the world. However, the man who's in charge of testing for the administration, Admiral Brett Giroir, said this. Take a listen.
There is no question that the more testing you get, the more you will uncover, but we do believe this is a real increase in cases because the percent positivities are going up.
The percent positivities being the key there. Look, you were in an emergency room last night. You've seen this firsthand throughout the course of the last several months. I'd ask for kind of your impression, too. When you look at the case numbers, you see the percentage of positivity going up. What is that telling you?
So there's 2 things that are concerning here. So one, that percent positivity tells you that of the group of people that you're testing, a larger percent of them are positive, which means that we're probably missing a lot of people out there, which makes us concerned. It means that there's a higher overall number of cases in the community. So it's not just that we're testing more people, it's that there are more people out there, period. In addition, the other thing, as Dr. Jha mentioned, is that hospitalization rate. My ER colleagues in Houston, Arizona, and Florida are telling me that their ERs are being overwhelmed with COVID patients, which means that we're not just having people that are testing positive and staying out in the community. President Trump likes to talk about how 99% of people don't get sick. That's not true, and we in the ERs are seeing that. We're seeing that this disease has very real consequences, even for young people, and that our ERs, our hospitals, and our intensive care units are getting full.
You know, Dr. Jha, one of the things when you talk to administration officials, you talk to people who kind of question the top line numbers, not the validity of them, but what they actually mean. And they point to death rates. And you look at the trend line of death rates, while it is a number that has lagged throughout the course of this pandemic, it has gone down. What is that telling you right now about why there seems to be a difference between positivity and death rate?
Yeah, so there are a few things I think that explain death rates as we're seeing them. First is that it is a lagging indicator. So we know that typically, even when somebody's sick enough to be hospitalized, it takes a couple of weeks before they end up dying because we do a lot to try to keep people alive. Second, we are getting better at treatment. So there are people who are spending 2 weeks, 3 weeks in the ICU and then surviving. Those people come out pretty sick with potentially very long-term consequences. And the third is that we do think that there is a younger population that's getting infected. And so I'd expect the mortality rate to be lower up front. What I worry about, of course, is those people still get sick and have long-term consequences. And second is they can go on to infect other people, older people over time. So I don't take a lot of comfort, but it's always good to see fewer people dying. That's a helpful thing.
Yeah, and can I ask Dr. Ranney, in terms of the kind of how the American population is handling this, I want to pull up two graphics here. One is a chart from Gallup showing how concerned people are, the fear that's out there right now. And you can see the trajectory. The trajectory is going up. Right now, it was 48% a couple weeks, 1 week ago. Now it's at 65%. However, you look at the U.S. Mobility Index, which, if you look at the red lines, that shows you when people were really staying home a few months ago to now, and we're almost back to baseline here, baseline of almost normalcy in terms of how people act. How do you square those two?
Honestly, Phil, I think people are tired. I think that people are exhausted of being away from their family and their friends. They think that they look around their community. They don't know anyone personally who's been infected. They think it's probably safe to go out. And it becomes tough as a human being to square what you know is the safe thing to do with what you're just so aching to go see and go to a barbecue or to see some friends. I hope that people can continue to find ways to have that social connection in a way that keeps them safe.
So, Dr. Ranney, on that point, you tweeted out something that I actually think is really helpful in terms of people that are looking to have that social connection, and that is essentially a risk rating system that can tell you kind of low risk to high risk activities you can and should be doing. What kind of stuck out to you about that? I've found it very valuable walking through it. What kind of stuck out to you as you look through it?
Thank you. So there are a couple things about that graph. So first, it's a good overall guideline, but it's not a perfect one. So there are some things on there that we might quibble about. The second thing is that where you go on that graph depends a little bit on who you are. So if you are high risk, have multiple chronic conditions, are elderly, or if you're in a state with a high prevalence of COVID, if you're in Florida, Texas, Arizona, you're going to want to move down on the level of risk that you tolerate. But the things that stuck out to me are that the outdoor activities are generally safer, and that those big indoor activities, bars, parties, they mentioned churches, it's a chart from Texas, but also political rallies. Anything where you're inside with a lot of people yelling, screaming, talking loudly are the most unsafe. And then within that, if you wear a mask, if you maintain a little more distance, you're likely to be safer.
And Dr. Jha, real quick before we go, you guys have been mentioning hospitals, particularly with the positivity rates going up. We've had months to prepare the hospitals for a next wave. This is still the first wave. What's your sense right now of the preparation? How ready are hospitals for what's happening right now?
Yeah, and this is an area where Dr. Ranney has really been kind of leading the national charge, but I will say that I think hospitals are better prepared for this wave than, this part of the wave than where we were a few months ago. But many hospitals are already starting to feel shortages again because we didn't use the last couple of months as effectively as we could have to ramp up our supplies. And so I'm worried that we're going to get into shortages once again in the upcoming weeks. Yeah.